today are the Honorable Andrew Furey, Premier of Newfoundland and Labrador, the Honorable John Haggie, Minister of Health and Community Services, and Dr. Janice Fitzgerald, Chief Medical Officer of Health. Please stand by. Our news conference will begin shortly.
Good afternoon. Thank you for joining us for the Government of Newfoundland and Labrador's COVID-19 update for today, Wednesday, May 12th. I'll turn things now, as always, over to Dr. Fitzgerald for the latest update. Dr. Fitzgerald.
Thank you, Premier. Good afternoon, everyone. Thanks for joining us. Since the media advisory yesterday, we have 10 new confirmed cases of COVID-19 in our province. 4 cases are in Eastern Health, and all are travel-related. 3 are between the ages of 40 and 49 years, and the third is between 20 and 39 years. 3 cases are in Central Health. 2 individuals are between the ages of 20 and 39. One of these is travel-related, and one is a contact of a previous case. The third case is between the age of 60 and 69 and related to travel. 2 cases are in Western Health. Both are under the age of 20, and both are contacts of a previous case. And 1 case is in Labrador Grantful Health. The individual is between 50 and 59 years of age, and the case is travel-related. The total number of cases in our province is now 1,166. There have been 6 new recoveries, and we have 81 active cases in the province. 1 person is in hospital due to COVID-19, and a total of 137,037 people have been tested to date. Importation of the virus due to travel continues to drive our provincial case count higher, and there have been instances where COVID has spread to contacts outside of the household of travelers. We now have 3 confirmed cases associated with a school in the Cadre Valley area, and Western Health is encouraging anyone in the area to get tested for COVID-19, regardless if they have symptoms or not. While we do not have any evidence that there is widespread community transmission in the region, there has been clearly spread among contacts. And given this, and the fact that these are variant strains which spread quickly and easily, I'm introducing a special measures order today to move communities from South Branch down to Port aux Basques, including Cadre Valley, and across to Rose Blanche, Harbour Lacou, to Level 4, effective tonight at midnight. Please refer to the provincial government website, gov.nl.ca/COVID-19, to remind yourself of the restrictions associated with Level 4. This will give public health the ability to carry out their investigation and conduct community-wide testing in the area while reducing the risk of onward transmission and spread. We will reevaluate this SMO in 1 week. Today, we are announcing new testing requirements for travelers to improve surveillance and further reduce the risk of COVID-19 spread. Effective 12:01 a.m. Saturday morning, a special measures order will be in effect, requiring all travelers age 5 and older to be tested according to their self-isolation arrangements. Asymptomatic travelers who can self-isolate fully away from others are required to be tested once near the end of the 14-day self-isolation period on days 11, 12, or 13. Fully self-isolating away from others means staying in a separate dwelling or a completely separate area of the home with a separate bedroom and bathroom and no contact with anyone else in the dwelling. Asymptomatic travelers who cannot self-isolate away from others are required to be tested twice during the 14-day self-isolation period, upon arrival on days 0, 1, or 2, and again near the end of the self-isolation period on days 11, 12, or 13. This applies to travelers isolating in a home where others are living, where there is no separate bedroom and or bathroom. In this case, the whole household must self-isolate. There will also be an option for travelers to avail of a test at days 7, 8, or 9, and at day 7 or later, household members of the traveler may also avail of testing. Travelers can arrange for testing by completing the online self-assessment and referral form anytime up to 7 days before their arrival in the province. This new testing protocol does not apply to essential workers and rotational workers coming from non-outbreak sites in Canada, as they would be subject to their own existing protocols. It will also not apply to any traveler in the province for 2 days or less. We have very good news to report today on our vaccine rollout. All regional health authorities have now started vaccinations for Phase 3. Booking is currently open to anyone over the age of 12 who is clinically extremely vulnerable, as defined in our vaccine plan, as well as anyone over the age of 50. As well, we have expanded eligibility for those aged 12 and over living in the same households as rotational workers. This will provide protection to those most at risk of exposure to COVID-19. Today, we are expanding this eligibility again to individuals over the age of 40. And on Friday, we will be expanding eligibility to individuals over the age of 30. On Monday, May 18th, the remainder of the eligible population, so those 12 and older, can book their vaccination appointment. As a reminder, you can view appointments for your priority groups in your region by selecting the word book on the government's homepage, gov.nl.ca. Regional health authorities are working on plans for the immunization of children 12 and over, and we expect to have further information for schools and parents in the coming weeks. As Health Canada's approval of the vaccine is contingent on age, children can only be immunized on or after their 12th birthday. We have reached another significant milestone in our vaccination program. Over 200,000 individuals have now received at least one dose of vaccine. And while it took us 4 months to reach the first 100,000, it was only 4 weeks to reach the second. We expect that by the end of June, all eligible individuals in our province will have been offered their first dose of vaccine. This is a reflection of both our increased vaccine supply and the swift efficiency of our regional health authorities in getting doses administered as soon as possible after they arrive. Currently, our risk remains high as other jurisdictions in Canada continue to experience significant community spread. Most, if not all, provinces are starting to see a reduction in new confirmed cases, which is an indication that things are moving in the right direction. We expect that we will continue to see a steady influx of cases from travel in the coming weeks, and we all need to remain vigilant. In the coming months, we should start to see the balance shift in our favor as more people in our country and our province are vaccinated and protected against COVID-19. And we are beginning to see promising evidence emerge on vaccines and how they impact COVID transmission. And we continue to monitor this real-world evidence as well as epidemiology as we plan for our future in Newfoundland and Labrador. As a recap, we have 10 new cases since yesterday's advisory, and the total number of cases in the province is 1,166. Before I conclude, I want to share information about a fundraiser happening in support of mental health and addictions programs at the Pottle Centre in St. John's. The centre will be hosting a Defeat Depression campaign, and I'm wearing this t-shirt today to help promote this cause. The centre is raising money for a new therapeutic horticultural program for clients, as well as funding for a new home. Defeat Depression is a national fundraising campaign that allows individuals or organizations to raise funds in support of their local mental health programs and services. For more information, please visit defeatdepression.ca. Finally, to everyone in our Muslim community celebrating the end of Ramadan tomorrow, I wish you a blessed and safe Eid. Hold fast, Newfoundland and Labrador. Thank you.
Well, thank you, Dr. Fitzgerald. Certainly encouraging science looking into the summer months. Over the last few days, we've seen a slight increase in the number of positive COVID-19 cases in our province, but I want to assure everyone out there, we are on it. We know that these are mainly travel-related or close contacts of those who have traveled. The measures taken by Dr. Fitzgerald on the southwest coast are intended to help contain any potential spread. The number that encourages me, though, is the number that Dr. Fitzgerald referenced, those who have received their first vaccine. As of yesterday, more than 200,000 people in Newfoundland and Labrador have received their first dose. What an incredible accomplishment. On a personal note, today I booked my own appointment to get a vaccine as it opened up for those of us who are over the age of 40. So please, if you're in that age group, please pre-register. And it certainly won't be long for others as other age groups continue to roll out as Dr. Fitzgerald suggested. We are indeed on track to have everyone vaccinated with their first dose by July 1st. What a difference that will make to this summer, to each and every one of you. No doubt many of you are watching this and seeing what's going on throughout the rest of the country. Indeed, it is concerning to see how quickly the virus can spread, which is why it's so crucial right now, perhaps more than ever before, to continue to follow the rules. We are close, but we're not there yet. As the weather improves and people get out more, please continue to do your part. As you've seen, your sacrifices pay off. Please follow the guidelines put forward by Dr. Fitzgerald and her team. And with that, I'll turn it over to Minister Haggie for his brief remarks. Minister?
Thank you very much, Premier. May the 12th, Florence Nightingale's birthday, and typically taken as the middle of National Nurses Week. Again, I've said it before and I will repeat it. We have an amazing group of nurses in this province who have and continue to go above and beyond. Only this morning, I received a lovely letter from a mother of a young man on the autism spectrum disorder. It was sent to me by the new CEO of the Autism Society, and it described a really wonderful encounter when he needed his vaccine They went out to the vehicle. He had no sensory overload, and it was really a remarkably stress-free experience, both for him, for his family, and for the nursing staff. And that's just one small example of what we see every day from our colleagues in nursing. So again, thank you. 81 active cases, more than we would like, but really it is a testament to the fact that the way our society works is we have a lot of travel, even under conditions of a pandemic. The people who are coming into this province are Newfoundland and Labrador residents. They live here, and they have traveled for a variety of reasons. They've traveled for study, they've traveled elsewhere for family emergencies and family reasons, and they've traveled for work. Of last week's new cases, 37, 4 of them were international travel, 26 of them were domestic travel, and 7 of them were contacts of one or the other. These people need to do this traveling, and the important thing is that most of the time we have no doubt that they are following the rules and following Dr. Fitzgerald's guidelines. I think it behooves us all, however, to continue to do that because the end is in sight. We have seen some challenges in communities on the southwest coast, hence a proportionate response designed to allow time for public health to do the job, contact tracing and testing to see exactly what the situation is in that area. In terms of the other big picture, our situation is a race between the virus and the vaccine. You've heard the figures for today. We have currently 34,000 doses in inventory, which are allocated over the next 6 days now to the end of the working week. We're expecting another 34,000 at the end of this week, which will be our inventory for next week. So we have a steady pace of vaccine delivery. The number of people in this province vaccinated with at least 1 dose is just over 41%, rather. That is consistent with the middle of the pack in the rest of the country, and the range is very narrow, suggesting that the allocation of vaccine has been equitable, and we've got our fair share, and we've not sat on it, we've administered it. We have only 2% of our population with a second dose, and that will be obviously the task for the next phase. But we're back on track now for July the 1st for everybody who's eligible who wants their first shot. So I think the important thing at the moment is to recognize that more vaccine is coming. We're engaged our pharmacists, we'll be engaging our physicians, and so sometime before the end of this month, the choice as to where you get your vaccine will increase significantly. On the notes of what we can all do is we can follow Dr. Fitzgerald's guidelines and we can be kind. It's worrying, it's concerning, but it's under control. Enjoy your week, nurses, and I wish you well, and thank you very much, Premier.
Well, thank you, Minister, and I should join you in wishing all the nurses out there on the front lines a happy Nurses Week, and certainly miss many of you who I've worked with over the years. I hope some of you are listening, but I know you're working hard, and we truly appreciate every single one of your efforts, especially during this troubling time. I'll now invite questions from the media.
Thank you, Premier. For the benefit of our speakers, there are 6 reporters registered for today's call. The first round of the question and answer session will give each reporter the opportunity to ask 1 question and 1 follow-up. Following this, there will be a final round where each reporter will have the opportunity to ask 1 final question. Our first questions are from Kellyanne Roberts with NTV. Please go ahead.
Thank you. Dr. Fitzgerald, are there any plans to change the use of AstraZeneca in the province after Ontario has stopped using it for first doses and Alberta has done the same? Alberta's due to a shortage of vaccine when it comes to AstraZeneca. Are there any changes for that vaccine coming to Newfoundland and Labrador?
Yeah, so, you know, as you're aware, we were offering that vaccine to those 55 and over. So at this point now, given that we were able to open up mRNA to those younger than that age group. We will not be offering AstraZeneca for first doses at this point. Certainly, we will still have some doses on hand for people who may not be able to receive an mRNA vaccine or choose not to. But by and large, there is the evidence right now supports using an mRNA vaccine in the age groups.
Thank you. And with the rise of cases recently, and we know that majority of them are travel related, do we know if any of the cases are people who have been vaccinated?
Yeah, so we have had some cases in people who have received one vaccine, and that's something we keep close eyes on. Obviously we want to make sure we know what's happening post-vaccination with regard to transmission. I will say that in those cases that we've had post-vaccine, we haven't seen severe disease to this point, but we certainly have seen it, and that's not unexpected, given that nothing is perfect, and with the numbers that we've given, it wouldn't be unexpected to see a few cases.
Thank you.
Our next questions are from Peter Cowan with CBC. Please go ahead.
So far, the cases that we've seen on the southwest coast are tied directly with the school. Why do a community lockdown when so far there is no evidence of community spread?
So at the moment, what we know is that this is, we have some transmission in the school, and we don't know exactly what's happening in the community, but we want to reduce that forward transmission. So if there are any people who were exposed to cases that we don't know about yet, that may very well, be passing it on. We want to try to reduce that forward spread as much as possible. By all accounts, this looks like a B117 cluster, and so we want to make sure, we've all seen how quickly that can spread. So we want to make sure that we are finding those cases and that we can limit the amount of onward spread in the area. So we think, for a short period of time, we give public health time to do its job, time to get that testing done, to see where we are, and then decide from there where we need to go with it.
Children of rotational workers are still able to go to school even when they might have a family member isolating, and they do their 3-test regime as those restrictions get loosened. What do you say to people that this is an example of why that's dangerous to have in place and it presents too much of a risk then for other students?
So we don't know that this is the case. The investigation into this cluster is ongoing, and so I would not jump to say that that is indeed the case in this situation. But what I can do is speak more generally and say that, we are testing rotational workers when they come into the province in those first few days. We're advising them to stay away from their families until they have that negative test. Then once they have that negative test, they can go with their families. They're tested again on day 7. And the risk of spread, from that first test to the worker developing a high enough viral load on day 7 to be tested and to become contagious, I think the lag time between when their family members could potentially be infected or contagious would be very short, and we would pick them up at approximately the same time. So, we think that 3-test regime that we have for them certainly reduces the risk significantly of spread into the community.
You can't forget that you can only avail of that if you're not coming from an outbreak site as well, right? So there's a layer above that you have to qualify to get into that rotational working protocol.
Our next questions are from Richard Duggan with VOCM. Please go ahead.
Thank you. So for the move to level 4 on the southwest coast, those measures will be reviewed in about a week's time. Why are we going with a 1-week review period as opposed to the 2 weeks that we have done in the past when we've had the lockdown?
The last time that we had a situation. We knew that by the time, we had locked it down, we knew that we had lots of cases, and we knew it was going to take at least 2 weeks for us to work through anything really. Whereas this, we have much fewer cases, and so we think, we can, and it's a smaller population that we're dealing with, slightly more sparsely populated area, so less populated area, sorry, and so we think that, a week will give us some information. We may decide, we may get information in that week that tells us that we can't come out of it in a week, and then we'll deal with that. But we want to give public health the time that it needs to be able to do this investigation and reduce the risk of onward spread. So we'll look at it again, and we want to reduce the amount of time, that certain businesses are closed and that people are not able to have contact with people outside of their households, and except in a couple of circumstances. So we're thinking about all of this and those unintended consequences as well. We want to reduce those as much as possible. So that's why we picked a week.
Okay, thank you. And wonder if we can get some sort of a breakdown of the positive cases that we're seeing. So, for example, what percentage of our cases are from rotational workers versus essential workers versus people with travel exemptions, that sort of thing?
So we do have those breakdowns. It's for the most part, cases are travel related, except for those with contacts. And the information that the minister talked about earlier in his opening remarks looked at the last week. So out of 37 cases, I believe 20, I can't remember, it's off the top of my head. But.
Yeah, Richard, I've got those numbers here. We had 37 cases, 7 of those were contacts, 4 of the remainder were international travel, and 26 were domestic travel. They break down to 19 rotational, 3 seasonal, and 4 other category of domestic travel. So that could be students or family returning home. I don't actually have the breakdown of those 4.
Yeah, and I'm not sure we'd be able to break it down any further than that. The information that we gather at the with the travel form is not, doesn't give us that specificity.
Thank you.
Our next questions are from Peter Jackson with The Telegram. Please go ahead.
Good afternoon. We were just given a breakdown of the number of rotational workers in the past week. I believe earlier this year, Dr. Fitzgerald, you were reluctant to give that kind of breakdown. And I'm getting the attitude from a lot of readers now, which, is troubling, but a lot of people are sort of saying, why can't rotational workers just stay where they are, either stay at work or stay home? Why are we letting them travel? What is your response to that? Is that part of the reason you're reluctant to give that breakdown?
Yeah, well, I think any time that, you have a group of people in your communities that are marginalized or stigmatized, you want to try to reduce that stigma as much as possible. I mean, rotational workers are doing what all of us, I think, try to do, which is to make a living, put food on the table, and take care of their families. And I think, to expect them to spend long amounts of time away from their families is kind of unreasonable, and would have significant effects both on themselves and their mental health, as well as the health and well-being of their families. So it's important for spouses to be together. It's important for children to have their parents around. So I think this is, if just put yourself in their shoes and think about it for a minute. How long would you want to be away from your family? So, I think we need to have a little bit of kindness and compassion here.
Okay, thank you. And with regards to stopping AstraZeneca, this is obviously a trend across the country. Ontario has decided it's not giving first shots anymore. Are you swayed, for example, by new numbers that the site in Ontario tomorrow that suggests the incidence rate of that blood clot condition is more like 1 in 60,000? Do you think that number is going to keep coming down, or where do you see that forward? I
don't know. I mean, it's It's difficult to say. I mean, initially when things happen, sometimes the connections aren't always made. So in the beginning, you don't see as many, but you aren't necessarily looking for them. Once we get a safety signal, then you start looking for them. So this may be a factor of the fact that we're able to diagnose it better at this point. It's very difficult to say if we'll see that number continuing to come down. But I think obviously we're going to keep watching it, and we're going to make decisions based on that evidence and based on the recommendations that the National Advisory Committee on Immunizations give us. So.
Okay, thank you.
Our next questions are from James Reed with All Newfoundland Labrador. Please go ahead.
Thank you. Dr. Fitzgerald, you said that the new travel restrictions won't affect essential workers coming from non-outbreak areas. Just to clarify, will this affect rotational workers also coming from non-outbreak areas?
So it doesn't apply to rotational workers coming from non-outbreak areas because they have their own protocol that they have to follow. And essential workers, the outbreak area doesn't really apply to them. Essential workers are generally people who are coming from elsewhere into the province to perform critical work in the province, essential work in the province. So they have another protocol that's separate that they have to follow when they come into the province.
Okay, thank you. And Premier Fury, is the upcoming tourism season in jeopardy, and does your team have some sort of support plan prepared to assist local tourism businesses?
We certainly recognize how important tourism is for our economy, and the tourism operators and the businesses surrounding tourism directly and indirectly are for the economy, for the communities, and frankly for the entire province's psychology and mental health. We are hopeful, as has been suggested by Dr. Tam, through modeling and looking at 75% of the Canadian population vaccinated by early July, that this summer will look different. It won't be as it was in 2018 or 2019, but it'll be certainly better than it was last summer. And I think that that's a reason to be optimistic towards the tourism sector heading into the summer. We have to be real as well and recognize that it won't be normal, but it's certainly a great first step, and I'm quite hopeful that it'll be different. That said, one of the things that we certainly know about COVID-19 is the only thing we know for certain is that there is uncertainty. And so we are currently looking at ways to help and support the tourism industry through this time of disruption so that they have the tools they need to emerge a stronger sector for the future of Newfoundland and Labrador.
Okay, thank you.
Our next questions are from Josie Basque with Radio Canada. Please go ahead.
Thank you. First of all, we talked a little bit about the AstraZeneca vaccine. Just to be clear, so it's still going to be, it's still available, still going for 55 people or older? Is that what I understand?
No. So right now, mRNA vaccine will be offered to everybody. There may be some people who are allergic to components of the mRNA vaccines who would require a different option, and so the AstraZeneca is an option that we have right now for them. But by and large, no, the vaccine that we will be using going forward will be mRNA.
Okay, and also you mentioned that people from 12 years old and older will be available to get vaccinated on Monday, May 18, but the 18 is Tuesday, so what's the exact date?
It's Monday.
Oh, my apologies.
Monday.
It was Monday. Yes, it was Monday. So the 17th.
So on the 17th.
My apologies. I guess.
No worries. Thanks.
I was reading off what was written. I didn't check the dates.
Lundi 17.
I will now go back through each reporter to see if you have one final question. Kellyanne Roberts with NTV. Do you have a final question?
Yes, wondering if we know if the case with regards to the school is of a variant, and if you can give us an indication about variants in the province right now.
Yeah, so it does appear that the cases involved in that cluster are related to B117. And pretty much everything we're getting in the province now is one variant or another. I think out of the last number of cases, I can't give you a number right off the top of my head, but I think we've only had probably 2 or 3 that have not been a variant of concern, and the rest have been. So mainly B117, but we are seeing some that are being screened as either the 1351s, the variant that originated in South Africa, or P1, which is the variant that originated in Brazil. But that's the screening test that we're doing. So it doesn't, we are waiting for whole genome sequencing to tell us which of those it actually is. But the majority appear to be B117, as we're seeing elsewhere in the country. But again, that's very much expected at this point. We assume now that anything coming in is a variant of concern.
Thank you.
Peter Cowan with CBC. Do you have a final question?
I do. A lot of people have questions about the AstraZeneca vaccine. So Ontario, for example, said they are expecting to get another shipment, and they're going to start fairly soon, and they're going to start second doses. So what is the plan for people who already have the first shot? Will the next shipments be used for them, or are you looking at mixing and matching? And what do you say to people who may have a bit of buyer's remorse now that they're seeing people 40 years and older getting an mRNA vaccine, who feel like, wait, I should have waited to get one of the superior vaccines rather than getting AstraZeneca right away?
So first of all, maybe I'll answer the second first. I think people need to feel, who got AstraZeneca, need to feel reassured that they got an effective vaccine and a safe vaccine. There are side effects, some potential side effects that are serious, but those are still quite rare. The benefit of us having our epidemiology the way it is that the chances of a severe case of COVID is actually quite rare as well. And so that's, you have to balance those risks for both of them. And people who at that time were over the age of 55 who got this vaccine, I think, they ended up getting it 2 to 3 weeks earlier than they likely would have gotten it. They would have had that protection a little bit sooner. They are now, getting a really good immune response to that, and so can feel that full benefit of one dose of a vaccine. So, I don't think there's any need to feel remorseful at this point. With regard to what we'll do with future shipments of AstraZeneca, I think certainly we are considering using it for second doses. We still are awaiting, advice with regard to whether or not we can mix and match and follow up. So follow up a viral vector vaccine with an mRNA vaccine, for example. So there are some studies that we hope will have some evidence from soon that will be able to inform that decision. So as soon as we know more there, we'll certainly be letting people know.
Thanks.
Richard Duggan with VOCM. Do you have a final question?
Yes, I do. With us opening to the rest of the population on Monday the 17th, I know that we're looking at bringing in pharmacists, for example, to help administer doses, but are there any other plans to ramp up testing sites or staff at testing sites to help deal with the increased demand?
For tests, or to use testing capacity for vaccination capacity? Is that the question, Richard? Sorry.
Vaccination capacity, sorry, my apologies.
Minister?
Thank you. Our ability to deliver vaccine is limited by the rate of supply. We're getting about 34,000 doses a week for the next little while. This will go up, I think, sometime around the end of May by another couple of trays, so we may be near 40,000. We don't have any difficulty administering that through our current setup. What will happen is, as the number of doses increase, the RHAs will add in some extra clinics here and there. What will make the difference, I think, is when we start to see Moderna reappear in substantial numbers. That's easier to transport, and I think that is where folks such as pharmacists and physicians will have a really important role, because that will enable some more geographical spread, perhaps to harder to service places where there's a pharmacy but may not be a practical or a really large RHA facility. So at the moment, we don't foresee any challenges from a human resource public health issue in delivering the doses we're going to get. We'd love to be in a position where we could actually divert some resources and do it even faster. But quite frankly, I don't think that's going to happen before the end of June, if ever.
Peter Jackson with the Telegram. Do you have a final question?
Yes. The kidney transplant patients are being told to call the vaccine booking line and request that they get their second shot at the prescribed time. Eastern Health being notified of this as well, apparently. I'm wondering, is that being accommodated? And are there other immune-compromised groups, such as cancer patients, being considered as well?
So at the moment, our recommendations for the majority of people is that, we're 16 weeks in between doses. And there are some groups that, or there are some individuals, I should say, that have been advised they need to get vaccine doses earlier, or, there are lots of clinical circumstances, and they're sort of taken on a case-by-case basis. So I don't know that I can speak to it in general. We certainly are looking to see if there's any new evidence that could influence that decision, and we will pivot if that evidence becomes available.
Okay, thank you.
James Reed with All Newfoundland Labrador. Do you have a final question?
I do, yeah. Dr. Fitzgerald, in the past you've mentioned that we need to have a risk of community spread or cases with unknown origins in order to revert back in alert levels, such as the case with Codroy Valley now. With the current case count approaching 100, is there a point where we would revert back in levels for the rest of the province?
No, not at this point, because our case counts, while they're high, and this is the danger with just looking at the number of active cases we have or our counts, the numbers may be high, but they're travel related, excuse me, and people are coming back and doing what they need to do. So they're coming back, they're isolating, they're not passing it on, or if they are passing it on, it's only to that very small household, that the small number of people and contacts, and so we're not seeing that spread outside of those very small clusters. Often we're not seeing spread at all. The people don't have any contacts, and they're actually following the rules quite closely. So I think we need to take the context. You can't just look at the numbers. You have to take things into context, because the person who's staying at home and isolating is not really at a risk to anybody. So we're certainly not going to be shutting things down if we don't see that risk of community spread. That being said, if we have to, we will, but I'm not going to jump there without that evidence to do so.
Thank you.
Josie Bass with Radio Canada. Do you have a final question?
I do, thanks. In terms of projections, how long or when do you think the majority of the Labrador-Grantful region will be vaccinated?
Sorry, the question was, when do we anticipate the Labrador-Grantful health region to be fully vaccinated?
Yes.
So I think, by and large, we've been giving vaccine based on a per capita allotment in each of the RHAs. Now, in Labrador-Grantful, a lot of that was front-loaded for them because they had a lot of higher risk groups, phase 1 groups. A lot of a higher proportion of their population were in phase 1 priority groups, and so they vaccinated a lot of people early on. But I mean, at this point, we're all on track to be done by the end of June, early July.
Thank you.
Thank you, everyone. Premier, do you have any final comments for today?
Well, thank you everyone for tuning in today. It's a good day. Over 40% of the population are vaccinated with 1 dose, and as we move into the summer, things look like they'll be very different from last summer. Just a final note to say thank you to each and every one of you for doing your part to keep us all collectively safe. And a reminder for those who are over the age of 40 and that you can register today. I did mine today, and as Dr. Fitzgerald suggested, for the other age groups, this will be coming in the oncoming days. So please register, get your vaccine. Getting your vaccine now is just as important as wearing face masks, social distancing, all those things were 6 months ago. This will be the final thing that gets us through this fight, and please do your part and get your vaccine. Thanks very much.
Thank you, Premier. Stay safe, everyone. Take care of yourselves and each other, and enjoy the rest of your day.
This is Jan. Jan sometimes visits her neighbor Paul. Paul has COVID-19, but doesn't know it. Jan also takes the bus. So does Mo, who's a frontline worker. So if Paul infected Jan, Jan could infect Mo, who could infect a lot of people. But wait, they all have the COVID Alert app. So Paul tested positive and entered a code in his app, which anonymously alerted Jan, so Jan stayed home and Mo went to work safely. Phew, close call. Help break the chain of infection. A message from the Government of Canada.